Hi everyone, I'd like to thank the Southeast eHealth team for inviting me here today to talk about the InterRI project. So, InterRI is an international resident assessment instrument. The organization I'll get back into in the next slide, and CHAL stands for Community Health Assessment. So the goal of the project was to implement a common assessment tool across the community support sector here in the Southeast. I was working East with a little bit, been working around Mississauga well and to implement it in their supportive housing area. The purpose of using this tool is to assess client service needs through a standard approach in all community support agencies, assist the facilitation of communication to other parts of the healthcare system by creating a common language and understanding across sectors. And a couple of examples is in the access centers across the province, they're using the InterRI MDS minimum data set. That's first generational of the InterRI instrument tool. And the long-term care across the province is rolling out the MDS 2.0, which is specific to long-term care. So what is InterRI? InterRI is a not-for-profit network with more than 50 researchers across the globe, made up of health, social service professionals, physicians, and researchers. The Canadian InterRI team is based out of the University of Waterloo under the direction of Dr. Hurdy. And more to the point, with the InterRI instrument for the common language, for first time in community support, we're actually asking questions in all of these fields listed. And much like what the Access Center does on their assessments with the InterRI MDS, they're asking questions in the same area. And our tool that we're rolling out has three components: the core and the mental health community assessment. Access Center function. The new version is called the Home Care Tool. It includes our CHAL and functional together. We only do a functional if it's triggered. So we're now collecting information that is relevant to other aspects of the sector and using languages that other professionals would be using. In a point in case on the medication, as I heard earlier this morning mention about the medication identification and helping people make sure they're using proper medication. We had an assessor go out to a client's home, complete the assessment, and got to a questions on medication. In community support, we don't typically ask questions around medication in great detail. With this assessment, we had to. There were many units, the list of when are they taking it. In completing the assessment with the caregiver there with the client, it was soon discovered that they were not using the proper medication. Their medication was old, and they were still using it when they should have stopped, and they did not understand how to use their nitrogen spray. So with this information, the assessor was able to work with the family and get them back to the physician to get the proper medication back on track and more education around using nitrogen spray. This is just one success we've had with using the assessment. So a little bit more about the project. From the beginning, for about a year now, the goal was to create the building blocks for a solid foundation. As Paul mentioned, I was starting from scratch on this project. In community support, we all have our different assessments, but this was the first time we had a validated tool to roll out. So there's a lot of change management involved here. Some of the obstacles we're coming across with this goal were the comfort level. Just our assessors being comfortable using this tool, our agencies being comfortable. What does this mean for us using this data and going out asking questions that we don't typically ask, as well as the comfort level from other health service providers. In us, all the other ones we don't answer. When you ask in community support, not all our assessors are registered professionals. They don't have a nursing degree or a medical background, but most are social workers or grown up from the roots of experience. How do we use the data? Where do we start? Software. In order to get the full value of this assessment, you do need software to go through and get outcome measures, NAPLA scores, clinical assessment protocols, areas of where we should focus our attention. support, and resources. Some of the strategies that we use and learn overcome that obstacles. Went out and extended connections with the project team. We made connections with New Zealand and Australia, actually. They had already rolled out the Inter-Eye instrument. As I said, this is a global instrument, and so we had an evaluation done that was out there. So we had many learning outcomes from there. Ontario CCAC, our local CCAC, Mississauga Holton CCAC, very great help there for what worked well in their rollout, what hasn't. And of course the Canadian Inter-Eye team. Data workshops, how to use the data. We started making expert boards available to show us how to use this data to support our decision making. But also from a fundamental level for the clinician, how do we interpret these care plans? And that these caps that are coming out, we can have a nutrition cap, but we provide services of Meals on Wheels and transportation. Is that nutrition cap really telling us we need to get meals in place, or is it simply that they can't get out to do their grocery shopping, so they actually need transportation to get out there? Why is that cap being triggered?